best medications for kids with ADHD. There is no simple answer here, but there's one that you definitely need to hear. Hi, I'm Ryan. I'm a licensed clinical social worker, school social worker, certified ADHD clinical services provider, and my most important job is I'm a father to a son with ADHD. So parents ask me all the time, what is the best medication for kids with ADHD? And what I explain is this. Well, number one, I'm not a licensed medical professional, and you should only take advice from a licensed medical professional, but I'm going to share what I've seen in my observations, which is there is no best medicine for everyone because every kid responds differently to ADHD medications. So one that might have worked for your son or daughter isn't going to work well for somebody else. One that your son or daughter might have had a bad reaction to is one that can work beautifully for somebody else. I'm going to use my son as an example. My son was on Concerta for probably 12 years, and that whole time he only went up in dosage once. That's what worked for him. But at the end of the day, what you have to understand is because one medication does not work for your son or daughter, that does not mean that all of them are not going to work. This is a really big mistake I see parents of kids with ADHD make. If their child has a negative reaction to one medication, then they say, oh, well, he can't take stimulants. And that's not true at all. It means that you have to try different ones under the supervision of a licensed medical professional to see what works. I do want you to know that stimulants are the most researched medications in the history of the psychiatry field. They are also considered the safest. And the really important part of this I want you to know is there is a tremendous amount of misinformation, I should actually say disinformation out there about ADHD medications. The number one place I see for disinformation is on ADHD Facebook groups. And unfortunately, the number two source for this I hear is from therapists who are not informed about ADHD. And third would be uninformed family members who like sharing their opinions about everything. Please know that there most likely is a medication or a medication regimen out there that works for your child, but it's going to take some trial and error to find it, and it might even take several months or longer to find that. The beautiful thing about stimulants is that they are in and out of your system the same day. So if your child has a negative reaction to one, there's not going to be kind of any lingering effect from that. Here are the two most important things I want you to hear. The American Academy of Pediatrics treatment recommendations for ADHD in children 6 and up are medication management in conjunction with parent behavior training. That's the part that I do. And please know that as of right now, no type of homeopathic or alternative medicine type of treatments have shown to be effective in treating ADHD symptoms in children. And here's the most important thing I want you to take away from this video. The research data outcomes for people with ADHD who go unmedicated are not good. The most alarming one is the fact that people with ADHD who go unmedicated have a 100% higher chance of developing a substance abuse problem. So often parents think, well, I don't want him going on an ADHD medication because he might have a substance abuse problem later in life as a result. Actually, the opposite of that is true. So not being medicated increases your chances of developing a substance abuse problem by 100%. And that is certainly the trajectory I've seen in the many adults with ADHD I've spoken with who are now in recovery. So please remember, only take medication advice from a licensed medical professional who is treating your child. And please do not be swayed by family members who like sharing their opinions or uninformed therapists or ADHD Facebook groups where parents love to tell other parents what to do. Take care.